Welcome back, viewers. Thank you so much for tuning in. If you haven't subscribed to the channel, please do subscribe and hit that notification bell so that when I post, you'll be the first person to know and you'll be able to watch and actually share with others. For those who are coming back to the channel, thank you so much for tuning in and thank you so much for supporting by watching. In today's video, one of the colleagues actually sent me a LinkedIn message and asked me what are some of the self-care practices for maintaining good mental health. So today's video, I'm just going to be talking about some of the self-care practices that will enable one to maintain good mental health at the end of the day. So without wasting much time, let me just put a disclaimer to say I'm not a guru in the field of mental health or in the field of self-care, but this is information I am sharing from my own self-directed learning as well as from my own experiences. And I hope that possibly somebody might be helped with information I'm going to be sharing today. If you need information specific to your situation, please consult with the GP or consult with your mental health practitioner who will be able to support you accordingly. So the first and foremost, what I'm going to be saying is that taking care of your mental health is essential, and it is one of the requirements as a professional to make sure that you regularly check in with yourself in terms of how you are doing emotionally and how you are doing in terms of your mental health, so that you'll be able to help others. Remember, as professionals in the helping in the helping profession, we should be able to take care of ourselves first to enable us to take care of others, really. So point number one, that's really important. So I'm just going to be giving about 5 self-care practices, really, which I think will also enable you to be able to maintain good mental health for yourself. First and foremost is to stay away of your mental health. Stay aware of the state of your own mental health. What do I mean by this? I mean, you need to regularly check in with yourself in terms of how you feel, pay attention to your emotions, your thoughts, and your overall mood, really. Remember, sometimes your mood might change because of the weather, for example, and sometimes your mood sometimes changes because of what you are going through in your own personal life. So you need to make sure that you regularly check in with yourself and pay attention to your emotions, your thoughts, as well as your overall mood, really. Self-awareness, by you being self-aware, that's the first step that you may actually take to make sure that you can actually take care of yourself. Because remember, if you don't take care of yourself, you won't be able to take care of other people out there. So remember, that's really, really important. Point number 2 is to make sure that you do nourish your social life. What do I mean by you nourishing your social life? Remember, you shouldn't be living in a vacuum. Even at work, you don't work in a vacuum. You work with other professionals, you work with other colleagues in a team, and you need to connect with those colleagues to make sure that you are all supported where you feel you need support, but also in your own personal life, in your personal space. Make sure that you connect with friends, you connect with family, and other individuals who are supportive, either of you as a professional or you as an individual at home. So make sure that you connect with those. Why do we think it's important for you to connect with them? Because it refreshes your mind. It can actually help you to focus from the busy schedule of your life to something else that may actually ignite and incite your mind to actually think about something else, really, so that you can actually properly take care of yourself. The other important thing also is to make sure that social interactions, it actually provides some emotional support, in the sense that it reduces feelings of isolation, so to speak. So it's important for you to actually connect and make sure that you do nourish your social life. When I talk about social life as well, I'm including about sometimes even taking time to, if you are a social media person, taking time to watch even videos on social media, YouTube, or whatever it is that excites your mind, Netflix, whatever it is. Make sure that you do connect with your social life and you connect also with your socials as well. Point number 3 is about making sure that you try peer support. Remember, I spoke about you not working in a vacuum, so you've got peers that you do work with, you've got other professionals that you do work with. There's nothing wrong with trying peer support and make sure that you actually get some support from them. However, remember, there is also peer support groups that you can join, whether at work. There are some network groups which are there in most local authorities. If you're working for a local authority, there are also some peer support groups which are operational in many local communities as well. The reason being that it helps you to share experiences with others who may understand what you're going through, and who may also understand things from your own point of view, and who may also understand the complexities or the difficulties that you are facing, or people who may have gone through the same exactly. I can give you an example of joining a peer support group when for example you've been diagnosed with cancer, or when for example when you've been diagnosed with another terminal illness. If you join a like-minded peer support group, it helps you because you're actually interacting with people who have gone through what you're going through and may have actually passed the stage of denial where you're up, for example. So it's really important for you to also make sure that you do actually try peer support. And the other point I need to bring out when it comes to trying peer support is to actually highlight the fact that it also fosters a sense of community and validation for yourself. So be mindful of that. And point number 4 is to make sure that you make time for therapeutic activities. What do I mean by that? Therapeutic activities include journaling. Sometimes it can be cathartic, and sometimes it helps you process your emotions. If you actually write down your thoughts and your feelings, articulate what you're going through. Sometimes you may not be able to have somebody to talk to, but if you actually write it down, you'll be able to actually keep track of trends of how things are. If, for example, if it is a particular month of the year where you have got major difficulties with your mental health as compared to the other months, then you can actually tell the trend, and then you can look at, okay, what if it is June and July, where my mental health kind of suffers, then you look at what exactly do you usually go through when it comes to June and July. Then you can actually pinpoint what could be the triggers to the way you feel and all that. So journaling is also another important aspect that you can also take into account when it comes to trying to actually maintain good mental health. The other one is mindfulness and meditation. Um, I, 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 I don't usually do this, but I recommend it for others because I know I've interacted with people where it has been quite helpful for them. So when you practice mindfulness, it helps you to stay, present and reduce stress. It helps you to stay in the now and actually reduce potential stress, especially for others who may actually take it a step further and get some massages and stuff like that. I once worked in a local authority in London where staff would, we had massage Wednesdays and stuff like that, where you could, go and get a massage and, all at the cost of the local authority. I think it was one of the local authorities where people were kind of mindful of how it is important for staff to take care of themselves, and also making sure that you take care of your own mental health as well. The other important thing also to mention is the fact that you need to engage in hobbies. For me, I do love traveling. I do love reading. I do love watching TV as well. And also if you've got particular hobbies, for example, stamp collection, particular hobbies, for example, bird watching, you need to pursue those activities that you do enjoy, whether it's painting, playing an instrument, or sometimes it could be gardening. So you need to be, looking, at, engaging in hobbies that, can actually help you as well, leveraging your mental health to an extent. And then the next point is to make sure that you take care of your own physical health, because remember there's a link between physical health and your mental health. So if you don't take care of your physical health, it's easy for you to actually have some mental health issues. So you need to take care of yourself. How do you do this? Remember, you can go to the gym, or you can actually buy equipment and exercise at home if you are not somebody who wants to be in a congregation or in an environment where there are many other people who are there also doing the same activity as you. You can actually buy equipment and actually exercise at home. So you need to make sure that you regularly exercise, even taking short daily walks. I do try to take some daily short walks, but consistency is the problem because I'm not that consistent. But one thing I know is when I've taken a walk, it actually boosts my mood. It helps me with my overall health. It helps me to feel better, breathe better, and actually, feel better about my body, feel better about myself as well. The other important thing also under looking after your physical health is making sure that you eat healthy. Having proper nutrition, it actually helps you, both with your, physical and mental well-being. So you need to take care of that. If you are somebody who likes to eat junky food, you know how it is. It can also affect you. So you do it in moderation. I'm not saying don't eat junk food, so to speak, but you need to do it in moderation. And everything that's done to the extreme actually has got consequences, as you may know by now. The other important thing, which I'm also not so good at, but I always try, is to stay hydrated. For those who work with me, you always see me with my bottle of either juice. I'm not good with drinking pure water as it is, but I try to take juice or whatever it is, as long as it's liquids. I do try to take, to stay hydrated. But sometimes when I'm so busy and when I'm so swamped with things to do, I might have that bottle besides me, but I don't necessarily actually partake in it. So, but it's important for you to make sure that you stay hydrated, because dehydration can actually affect your mood. It can also affect your cognitive functioning, so you need to be mindful of that as well. The last and the most important thing, which I always emphasize to the people that I work with or the people that I supervise, is around taking time off work regularly. You need to make sure that you take time off from work on a regular basis. I usually try to make sure that every second month I take a week off, or every second month I take a couple of days off to make sure that I recharge my batteries. And when I go back to work, I feel rejuvenated, I feel renewed, and it actually helps me to stay focused and make sure that I do manage my tasks, effectively as well. The only other thing that I need to mention before I close in this video is to make sure that always to remind people that self-care is an ongoing process. It's not going to be a one-off thing and then you can say, tick box, I've done this. It's an ongoing process. You need to find what works best for you, and also you need to prioritize it in your daily routine. Even if it means you take a walk every other day, you need to make sure that you prioritize it in your daily routine. It's not easy. These days there are trackers, there are watches that you can wear, or phones that you can have apps on that can actually track the number of steps that you've taken for that particular day. And I know it's not easy when you are driving to work and coming back every day, or when you are just but it's easy for people who may not necessarily be driving to work. Sometimes they do take a bus, or they walk to the train station, which is like maybe a mile or a couple of miles away. Those people, it's easy for them to actually regularly exercise, because by doing the things that you do every day, you're already exercising. But you need to be patient with yourself. If you haven't met your targets, don't beat yourself, and make sure that you keep on consistently doing it, and over and over and over and over, until it becomes a routine. And I hope with those few words I've managed to convince one person to be able to properly take care of themselves. And I hope I've answered the viewer who is asked, what are some of the self-care practices for maintaining good health? With those few words, thank you so much for watching until the end. If you haven't subscribed, please do subscribe and hit that notification bell so that when I post, you'll be the first person to know. Thank you so much.